ya kusherehekea dhana hili ambalo kwa hakika karibia ngayebiri liatobire.
We have the opportunity to reflect on the successes of initiatives by government, communities, and individuals to combat AIDS. Kenya has made significant progress in reducing the transmission of HIV. This has been made possible by investment in resources and access to treatment. This has also been made possible by the united conviction we have that the sacrifice of families and communities to fight, this global pandemic. Community workers have been at the forefront of this battle, and I thank them for their tireless work and contribution to our country's success. This day also reminds us that our work is not done. We need to recommit and redouble our efforts to achieve our national and global target of an AIDS-free nation by the year 2030. HIV remains a pressing issue in areas where lack of access to quality healthcare services threatens our progress. In areas where there's no counseling and testing, this has meant that expectant mothers who miss their prenatal visits do not have safe deliveries, putting their babies at risk. Lack of access to antenatal care has also meant that HIV-positive mothers who are not on HIV treatment are not protected. Our efforts to eliminate HIV is central to the government's health targets for universal health coverage. Strengthening our health systems and increasing access is essential to our progress so that many more mothers can benefit from free maternal services. In addition, adolescents can get the information they need to protect themselves. This must be central to everything we do in our journey towards an AIDS-free country. I take this opportunity to appreciate mentor mothers for the role they play at the community level. They are instrumental in contributing to the reduction of preventable maternal deaths by ensuring that mothers deliver safely, are tested, counseled, and adhere to medication. It's because of our joint efforts that we made progress in reducing mother-to-child transmission towards 5%. Unfortunately, we have not sustained this progress, and we must work harder to reverse the current trends that are threatening progress in eliminating mother-to-child transmission of HIV. There's also significant increase of new HIV infections amongst adolescents and young women. As I visited the Kisii Teaching and Referral Hospital earlier, I was encouraged by the investment that this county has made by prioritizing women and children by dedicating a mother and child unit. This has been demonstrated further with the EMTC business plan and the faith booklet on HIV and health development to equip religious leaders with advocacy messages, both of which we are launching today. I urge stronger collaboration among community workers, including religious leaders who are central to the HIV response by being health service providers and community stewards. You complement government's effort in providing quality health care to the people, and for that we celebrate you.
Your Excellency, 31 years on, as we commemorate the World AIDS Day here today in Kisii, we recognize that HIV/AIDS epidemic in Kenya continues to be managed with great milestones recorded, as has been shared by our governor. Reflecting from the national level, the preference rates have come down from a high of 13% in the early 90s to the current 4.9 national rates, where we seem to have stabilized for now. New infections and AIDS-related deaths have generally decreased both in Kenya but also globally. Your Excellency, we continue to dream of an AIDS-free nation. And indeed, we have a story to tell as a country, as the figures speak. And in this regard, I wish to recognize the different communities, including the faith sector, for their dedication to the HIV and AIDS response in this country, which is the reason we have made the strides so far. I wish to recognize the partners who have joined us on the journey that we've been walking the last 3 decades. Over the past 3 decades, Your Excellency, we have seen many advances in health that in turn translated into longer, healthier lives for women. More pregnant women today deliver in medical facilities and are assisted by professionals, while more infants are living to celebrate their 5th birthdays. Your effort through the Beyond Zero initiative has had a major impact on service delivery for mothers and infants in the country. We are now able to deliver HIV-negative babies to HIV-positive mothers, taking advantage of improved technology. This we consider a low-hanging fruit that needs to be capitalized upon to deliver our elimination of mother-to-child transmissions targets. We have, however, noted with great concern a general retrogression in the recent years on EMTCT performance, Kisii here included. My ministry will work with you, Governor Ongwae, on a new strategy to regain the ground on this slip back to achieve aspirations that we envisage under universal health coverage. Your Excellency, it is a fact that resources for HIV/AIDS response have either flattened or in some cases reduced significantly in recent years. However, I'm happy to note that my ministry has received over 50% increase in funding over the last 2 years to address these responses, among others. We have also put in place mechanisms to operationalize the trust fund for HIV and NCDs. This is envisioned to inject the much-needed resources to re-energize the HIV and AIDS and comorbidities programs, and also bridge the existing resource gap across the county. Your Excellency, ladies and gentlemen, we are in the progress of developing our HIV/AIDS strategic framework, which will cover the year 2019-2020 to the year 2024-25. We will, as we develop this strategy, ensure that counties also have a reference policy document against which they will develop their own strategic plans.
We have increased the number of health facilities offering comprehensive HIV services from 112 to 143. We believe that the HIV-related deaths, they were standing at that time at 1,200. Right now, the records indicate, in fact, by 2018, the records were indicating they were 628, and that was 2018. I have not been given the records for this year, Your Excellency. The broader issue of the Kisii County HIV and AIDS Strategic Plan 2015-2019, we put it in place in 2015 and we've been following it. And the development of the first Kisii County elimination of mother-to-child transmission business plan, which is being launched today. I thank all the partners who have worked with us on this journey, and this is a journey that we want to ensure that whatever that stigmatization that is there on HIV and AIDS, it is a disease which should not be stigmatized.
So I want to associate myself with the progress that has taken place, where now the prevalence rate has dropped to 4.4%, which is almost more than 50% drop. What were the challenges? Acceptance, the youth, the women, and the society. And I know we are talking about the pandemic. The most important thing is that you know your status first. Because if we are in Kisii, 4.4 prevalence rate, it means 95.6 are negative. Why don't you go and know your status and then maintain that status?